of you. The topic of my presentation today is how to choose a thesis topic. Now, it's very difficult to actually know how to choose a thesis topic, but there are some rules one need to understand before you venture out choosing a topic of your thesis. Choosing this topic is actually an essential step in the life cycle of any postgraduate student. According to the National Medical Commission and the erstwhile Dental Council of India, writing the thesis is basically aimed at contributing to the development of a spirit of inquiry. Besides exposing the candidate to techniques of research, critical analysis, acquaintance with the latest advances in medical science, and the manner, the aim of a thesis is aimed to make a candidate be aware of these things. Now, there are three scenarios. What happens when you choose a thesis topic? Your supervisor or your department can provide you a general topic area and ask you to study about it and then look at a particular aspect for doing a research. Or he might provide you with a list of possible topics to choose from, or he might leave, or the department or supervisor might leave you to choose a topic, and you only have to obtain permission to write about it before beginning your investigation. What are the steps to choose a topic? What do you want to do? First of all, what is required is to create a mind map. Why a mind map? To generate ideas. Look for current journals or articles. Explore the selected topic. Make top 5. Discuss and select one of them. So this mind maps helps you in gradually filtering to the point where you've chosen your topic for research. According to Dawson, asking yourself 4 questions before starting a research project would be worthwhile. Why have I decided to do some research? How can I remain interested in my research? What personal characteristics do I have which might help me to complete my research? What skill and experience do I have which might help me in my research? So, all these questions will make you sure that the topic which you have chosen is likely to be of use. Now, how do you create a mind map? Mind map is a very simple and practical tool for improving creative thinking, planning, and problem solving abilities. It can help you to generate more ideas and make new connections. Now, the central idea is basically which is the core. Now, related ideas are added in a radial fashion, and you connect these ideas and evidences from literature. So you understand that the core is the key, and when these radial ideas are added onto it, and when we connect these ideas together, we are able to create a mind map of what question we are asking. So brainstorming for ideas is important. Now, you can either do it yourself or group brainstorming. Now, a postgraduate who has just entered into the field of study may not be able to do it just by self brainstorming. So, we'll need the help of peers as well as the teachers to be able to actually do a proper, brainstorming of the idea. Now, what are the 3 phases before you finalize the research? The first phase is deciding. Now, if you see this diagram on the left side, this is about how difficult it becomes for a postgraduate who has just passed, the undergraduate exam and is not, he doesn't know the intricacies of how to do a research. So, deciding is a very critical factor. What research question to answer? Phase 2 is planning. You need to plan how to gather evidence to answer the research question. Phase 3 is understanding and collecting the required information. So, if you will divide your, phases properly, you will be able to actually do your research in a planned manner. So the research process is actually, step by step. First, you initiate, what do I really need to find out? You locate, how do I find out the information? You select the information which is relevant and reliable, organize it, how do you use it, then present, and then assess whether you need to modify it or you need to upscale it, or what are the intricacies involved with it. So first of all, when you look at a topic, there is a broad area. Now, this broad area needs to be narrowed to be able to focus on what you want to do as a specific idea. Now, put up your idea into context, and then, if you have no idea, find inspiration. So, how this happens? A broad area into a specific idea, browse resources which are available, check reading lists, identify keywords, and find related sources. So, you might be saying, "Aap kehna kya chahte hain?" What are you trying to say? You're saying that how do I focus and get my research idea? So choose any topic. For example, I'm an orthodontist. I have chosen a topic of pain. It's a very, very broad area. Now be a little bit more specific. Orthodontic pain, pain related to orthodontic tooth movement. And be a little bit more specific. What are you trying to find out? How to manage this orthodontic pain. So repeat this process 3 or more times till you have a good topic. So it's like you are churning and you're able to come to the specific point which you want to investigate. So just as a lighter joke, thesis can become a headache for many of the students if not planned properly. So the critical aspect when you start a thesis topic selection is basically literature search. So the hierarchy of evidence is very important for any of the researcher to know that what is the level of evidence of a particular research. For example, case reports, case series are at the lower end of the rung, and meta-analysis and systematic reviews along with randomized controlled trials are towards the top of the pyramid. So there are a range of resources. We might have journal articles, we might have books and book chapters, statistical or factual databases, conference proceedings, theses done earlier, empirical or observational studies, and reports from government agencies and other agencies, and archival material which one would like to search before thinking about the research topic. So a number of databases are important. You have PubMed, you have Embase, you have Lilacs, Cochrane Library, Science Direct, Scopus, Web of Science, ProQuest, and Thesis Global, Sage Research Methods, EBSCO, and a host of various resources which can be utilized to actually look for a particular topic, what has been done about it, and what are the things which have not been. So when you look at how you process literature search, you find out the research question, you focus, you refocus. Search plan is you look at the search results by using various resources which have been mentioned before, use the mesh words, the keywords, and then evaluate and record, review and revise, and this is a two-way process. And finally, you have your literature review in place. Now, this provides you an opportunity to learn more about a given topic, but also provides insights on how the topic was studied by previous analysts. It helps to interpret ideas, detect shortcomings, and recognize opportunities. So the crux is to interpret ideas, detect shortcomings, and recognize opportunities. In short, systematic and well-organized research may help in designing a novel research. So, the word research is a double meaning word. What do you mean by research? For many of the academicians, what is told in traditional departments is get a reference article. Now, this is your master article. So, how are we going to end it? That's not research. You need to interpret ideas, detect shortcomings, and recognize opportunities. So the key is to know that what is lacking in research on that subject. So relevant research focuses on new or relevant substantial topic areas. So, what is new or relevant? For example, if something was done 20 years ago and we've redone it, we are reinventing the wheel. But a topic which is relevant today. For example, COVID happened. At that time, the topics which were relevant became critical, and these were the topics which got published very soon. Ideas that build an important gap in published research. So, the key is to localize what is gap in what is already published. Research that explores new dependent variables, relevant again. So, if we are able to locate this, and let me tell you, it's the study design and the study topic which will determine what is the outcome of that research. So, we might have done our best efforts to do a cephalometric study on something which used to be done many years ago. It's not likely to be printed anywhere, and it is going to be irrelevant in advancing science in any possible way. Now, what are the major challenges when you select a thesis topic? First is, and we end up selecting topics with a very broad scope. Try to be limited. Try to localize your topic. There is scarcity of research material relevant to the selected dissertation topic. So insufficient research on that topic. So you are not actually localizing what you want to find out. Selecting dull topics for the sake of just completing the task. So as a 25-year-old clinician who wants to do research, I'd like to suggest to the youngsters that the topic should be such which gives you a challenge. If it's not challenging enough, it is not something which is going to be worthwhile. Neither it is going to be published, nor is it going to be relevant in advancing science. Now, what is the criteria for a good topic? What topic would you say is good? Just keep it simple. Many times we have one topic where we've added multiple own confounders and made it complicated. The topic should have a very simple research question. It needs to hold your interest for that long time. It must be manageable in size. It has to have obtainable data. It has not already been sufficiently researched. It must have potential to make an original and significant contribution to knowledge. It must be doable within the time frame. Your postgraduate program is time-bound program, and budget is full. It should be acceptable to your advisor and the committee members. So it's like trying to make everything as optimal as possible among all these criteria. Now, there are different frameworks for topic selection. Two of them are very popular. One of the framework which is very popular is called FRIENDS. What do you mean by FRIENDS? For topic selection, F stands for feasible. That is in terms of manpower, in terms of time frame, financial, equipment, software, research capability. R stands for relevant. That is scientific, practical, social, personal. I stands for interesting, motivational, passion, curiosity. E is ethical. That is your study should follow code of ethics, human or animal studies. N stands for narrow, neither too broad, neither too narrow, focus specific research. D stands for discipline, that is core discipline, related discipline, and specifications and standards. And S stands for supervisor, his knowledge, his interest, involvement, commitment, and honesty. So it's a combination. So doing a deep research, exploring different areas and ideas, innovation, topic of interest, and putting this idea to practice. So this framework of FRIENDS is quite popular. Another finer area for topic selection is called FINER. What does FINER stand for? F stands for feasible, that is adequate number of subjects, adequate technical expertise, affordable in time and money, manageable in scope, interesting, getting the answer intrigues the investigator, peers, as well as the community, novel, that is new, confirms, refutes, or extends previous findings, ethical, amenable to institutional review boards, relevant, which is relevant to scientific knowledge, to clinical and health policies, and for future research. Therefore, you could use either of these criteria for selection of a topic. Now, why power and sample size are important? For results of any study to be creditable, it is necessary to have enough participants to have a good chance of detecting a clinically important treatment difference if there is one. Most good peer-reviewed journals accept a type 1 alpha error or significance of 0.05 and power or beta of 80% or 0.08. And I would recommend this article by Nicholas Pandis et al. In AJO-DO 2011, which talks about, it's about orthodontics, but it talks about generally about how a power of the study is critical and how to calculate power and sample size. Now, feasibility of a research is very important. We want to reach Rome, but when we don't have those circumstances around us, we might not be able to reach. It is necessary to assess the feasibility of a potential topic, whether the project can be undertaken with available resources in terms of manpower, time frame, financial, equipment, and other facilities, whether they're available to us or not. Ethics in research is a very critical factor. The first and foremost is that if you are doing a clinical trial, it has to be registered with the CTRI, Central Trial Registration Agency, and also necessary approval involving humans from competent authorities for clinical trials of drugs, risk of harming people, environment or property, privacy and confidentiality, society's cultural, moral, religious and legal values, honesty and integrity in conducting research. Now, how to approach your chosen topic? Step 1. Understand what the topic is about. What are the key words in the topic? What questions am I going to answer? Which sphere of knowledge does it cover? And what variables will be considered? So, first of all, we need to understand the topic. The second step is review related literature to help refine how you approach the topic and finding a way to analyze. Focus on identifying sources, that is literature, that support as well as refute this position. Has anybody written about it before? If yes, what is it about specifically? If no, what gap is my study filling in? Consider the limitations and future research discussed in journals. So this is a critical aspect. Then you need to know what is the research question. A formal tentative statement of the expected relationship between two or more variables under study. It helps to translate the research problem and objectives into a clearer explanation or prediction of the expected results or outcomes of the research study. And a clearly stated hypothesis includes the variables to be manipulated or measured, identifies the population to be examined, indicates the proposed outcomes from the study. So research question is the critical aspect. Now, it might be a quantitative research question. These research questions are precise, which establish a link between the research question and the research design. These questions typically include the population to be studied, dependent and independent variables, and the research design to be used. They are usually framed and finalized at the start of the study. How much or what is the difference? How often? How intense? Is there a statistically significant relationship link or correlation between? Now, these questions can be of three types. One can be descriptive, comparative, and relationship based. Now, adolescent seeking orthodontic treatment primarily to improve their quality of life. Is there a correlation between orthodontic quality of life and the American Board of Orthodontic Discrepancy Index in an orthodontic treatment seeking population? So, you have a research problem and you have a research question to it. So let's look at another research problem. Clear aligner therapy cannot be used for treatment of complex malocclusions. So the research question is, what are the differences in a finished case quality between Invisalign and traditionally fixed appliances? So, it's a very well-defined research question in terms of a research problem. Now, qualitative research question. It's used to understand the people's beliefs, experiences, attitudes, behaviors, and interactions. Also establish a link between the research question and the research design. Usually adaptable, non-directional, more flexible. As a result, studies using these questions generally aim to discover, explain, or explore. So, qualitative research questions are of two types. One is exploratory, the other is explanatory. For example, what factors influence the clinical success rate of mini screw implants? How does extraction of a second molar for orthodontic treatment affect the dentofacial complex? So, we need to know what kind of question, qualitative or quantitative. Sometimes a mixed method of research questions may be there. You require a set of both qualitative and quantitative research questions. For example, separate questions are appropriate when mixed method study focuses on significance and difference in qualitative and quantitative methods, not on the study's integrative component. For example, when you are adding qualitative research with the quantitative, you are getting a mixed method research. Now, let's look at an example. What is the perception? So this is qualitative of pain in patients undergoing fixed mechanotherapy for malocclusion with different anchorage requirements. So anchorage requirement is quantitative. Similarly, how is the patient's perception of facial aesthetics improvement related to the duration of orthodontic treatment? So, qualitative and quantitative aspects have been added to a mixed question. Now, let's look at the steps to formulate a good research question. First is the broad topic, focused area, scientific overview, and then comes the research question. So we've already come to a point how to formulate this research question. Now, tips on getting an idea for research. We need to start thinking early. As a student, we are trying to cope with the new environment, the new methods, journal clubs, seminars happening, preclinical work. So, we have to start thinking quickly. Choose the topic you are actually interested in. Review sources for ideas. The topic may change as you progress. Now, sources of research questions, theoretical or conceptual frameworks, previous research, discussing with experts what could be the real life experiences, academic literature. So there are a number of sources which can help you in formulating this research question. So, to summarize, I'd like to say that topic for thesis is a critical aspect of any postgraduate's life. One needs to outline the areas of interest, choose a topic which is broad, narrow your topic, identify a research problem, and then identify what you're going to study. Observe your environment, be curious, ask questions, read about your interests, talk to your colleagues, and find out what others are doing. In short, anticipate. From start to finish, there is a method to madness. Anticipate, discuss, plan, start it, do it, and finish it. According to Dr. APJ Abdul Kalam, thinking is capital, enterprise is the way, and hard work is the solution. Thank you very much for a patient hearing.